The Judge Rotenberg Educational Center outside Boston is the only one in the country known to use electrical skin shocks for its most aggressive patients, many of whom are autistic or have other developmental or intellectual disabilities.
The behaviors that the students at JRC exhibit are behaviors that the typical person has never seen before. Pulling out someone's eye, banging their head until they have a stroke. Just horrific behaviors.
Andrew Goldberg is one of the patients fitted with the graduated electronic decelerator, or GED, which delivers a 2-second shock.
We were afraid of our son. He would come near us and he would go for our necks. He would try to injure us. He would bite. He would hit.
Goldberg's mother says the skin shocks are the only treatment that has worked.
It has changed immensely, and we feel like we have our son back.
But others say it amounts to torture. This video, provided by Andre McCollins' attorney, shows the then 18-year-old shocked repeatedly in 2002.
The shock's not like you hear the JRC people say it's just a bee sting or it's just a pinch. It hurts badly.
The center insists procedures have changed since this video was recorded, including no more use of a restraint board and limits on the use of the GED, which require court approval.
No! I know that's what they say. Fortunately, we have medical records that say that this is an ongoing, continuing practice.
They say that it has no side effects and stuff, but that is not true at all.
Jennifer Musumba's mother is also suing JRC. They say Musumba was strapped down and received more than 230 electric shock treatments while a patient there.
I started to tell myself I must deserve it because that's the only way I could get through every day without just wanting to die.
After years of complaints from disability rights groups, the Food and Drug Administration is now considering banning the shock device.
There's a lot of concern about the downside of this approach and the harm and risk to the patients receiving it.
But Andrew Goldberg's mom hopes the GED remains legal.
We feel that device has changed the life of our son, and it really should be available for the desperate families who need this.
The FDA has not set a deadline for when it could make a decision. Matt Friedman, Associated Press.